Welcome to another episode of the Women Physicians Lead podcast, where we empower women in healthcare leadership to navigate the complexities of their careers with confidence and with clarity. So, I am coming to you today from my new co working space and podcasting studio background. I am loving just the vibrancy here. So, this is where I will be doing most of my recordings for the rest of the episodes for the podcast. So, I hope that you like my background, and I am just excited to be engaged with you today with another episode. So, the episode that we are talking about today, or the topic that we're talking about today, is when you are at the crossroads of a career transition. So, a lot of us are in this space right now, or we have been in this space in the past. And it's really about when you are not really stuck, but you feel like you have to make a decision. You're at a crossroad, right? Should you stay where you are? Should you move into a leadership role? Should you move out of your, current career path and into doing something totally different? Should you move from a clinical role to a non-clinical role? We all go through these periods of being at a crossroads of deciding which path to take. And today I'm going to share with you what that looks like, what that feels like. I'm going to share with you my own story of my crossroads and then give you some tips about how to navigate if you are at that crossroad. So, I know that this topic also resonates deeply with a lot of you because this isn't really just any transition. Usually, right, it's a pivotal moment, excuse me, in our careers. And it helps us to really think about where we are. And we have to really think about our current situation, personal and professional. We have to think about our identity and also about the future. So, let me share with you again a little bit about my own crossroad or my story with being at a crossroad. So, my transition started from being a full time family physician. I owned my own practice for 25 years, serving my community as a family physician, seeing children all the way through adults, doing some women's care, some minor surgeries, some dermatology, all the things that family, docs are trained to do. I had a full-time practice, was raising two kids at the time with all of the responsibilities a lot of times that we as women have. And I started feeling like I was at that crossroad, right? So things were happening in my life at the time. This was about 15 years to 20 years into my practice. And let me just say this, for a lot of us, it's normal to feel to have that feeling, right, of being at a crossroad. Because where we were 20 years ago is not the same as where we are now. Things change, we change, our feelings change, our passions change. The environment in which we live changes. We may find that we are passionate about some things now that we weren't before, and we need to be fulfilled in those areas. So it's absolutely normal to feel how you're feeling in this period of being at a crossroad and to actually be in that position. So my transition was being a full-time family practice physician to then deciding that I wanted to leave clinical medicine and move into a leadership role. And that was for various reasons, more flexibility, more time freedom. I wanted to also be able to explore different things that had interested me at that time. So I made that move. And then eventually coming to another transition of moving into becoming an executive coach. And I will tell you, so it was no walk in the park. I don't want this to seem as if it was easy by any means. It was filled with a lot of questions, a lot of fears of the unknown, which we'll talk about, feeling of, having moments of deep self reflection about why I was doing this. So I don't really want to give you the false impression that you can just jump out there, switch careers and everything will fall into place overnight, right? So with or without a plan, it truly is a marathon and not a sprint. So I just wanted to make sure that you are clear about that. So if you feel that sometimes you take two steps forward and one step back, it's okay. It is a marathon and not a sprint. So there are many questions that I kept asking myself during this transition, and I'm sure that some of these questions are coming up for you as well. So, one of the questions that I asked myself during this transition, which may be a common question again for other women in healthcare who are going through this, is why now? Right? I ask myself this a lot, girl, why now? You have practiced for 20 years, you did all this medical school training, residency training, continuing to study to obtain and continue to have your board certification. So why now? Why are you doing this now? And deep down, I think we know the answer to that question, but a lot of times we continue to ask ourselves that. And you have to think, what's maybe it's a desire, like I explained earlier, for time freedom. Maybe you need more flexibility at this stage in your career. Or maybe you just need to fulfill a part of you that's been lying dormant, that hasn't been fulfilled. So, why now is often a common question that comes up. If you are in clinical practice, another question that comes up is, what about my patients? What's going to happen to them? And this is a big one. I know this is a big one that a lot of women in healthcare, physicians, nurses, really struggle with is, what about my patients? You feel guilty about leaving them because of the relationships that you've built and because of the things that you've been able to accomplish, with your patients. So it's the what about my patients is another question that comes up. And then another question that came up for me, and maybe it might come up for you as well, is who am I without, and you fill in the blank, right? Who am I without my practice? Who am I going to be without, being in clinical practice? So your identity becomes or comes into question, right? Because our career has really been a significant part of our identity, right? I have identified myself as Dr. Lisa Herbert. That's been my identity. So now I'm thinking about stepping away from the thing, and sometimes that makes you feel or can make you feel like you're losing a part of yourself. So the who am I without the, again, fill in the blank is another question that comes up. So it's something that we have to begin to think about, but also start to feel confident in that we are who we are, even without that particular role that we may have had in the past, right? So we have to really make sure that we are building confidence in who we are and living our true, authentic selves. Another question that comes up is, what will other people think? So we go through a lot of this, even with other things in our lives, right? We're always wondering what other people will think. Will we be judged? What will our colleagues think, right? Our friends, our family. And sometimes this can play a huge role in your decision making process because we unfortunately allow the thoughts, the feelings of other people to weigh heavily on our own decisions when the decisions really should be made within ourselves. So, those are some of the questions that come up. And then let's address now the fears and concerns that come up with these questions that we just talked about, because the fears and concerns are the things that can be paralyzing when you're at a crossroad. So the fear of the unknown, that stepping into a new career path, leaving what was familiar behind can be paralyzing. A lot of times, it's a struggle to sort of think that you have to learn something new. You have to be in a different space. You have to be in a different environment. You have to learn how to interact differently. A lot of that is can bring a lot of fear and anxiety. There's also the fear of failure, right? Because again, we're moving into a new career path, a new environment, a new skill. We're not comfortable, a lot of times in that new space. So the fear of failure that we're not going to do well a lot of times comes up. There may be also concerns about financial stability because, hey, sometimes when we are thinking about a career transition, it might mean a temporary dip in income, or it may even be for some people starting over, financially. So there's a concern, obviously, about financial stability. And then there's just the guilt that we mentioned earlier. Again, this fear of feeling guilty about leaving the thing that you've done for so long, that you were good at and where you've helped people, and that feeling that you may in some way be disloyal. So now that we've talked about the questions that we ask ourselves, the fears that come up during a crossroads, I'm going to give you some tips for navigating this complex time, or what can be a complex time in your career. So let's talk about how do we navigate this challenging time for what we want to be a very rewarding journey. So, the first tip is to develop a roadmap. It's always good to have a plan. I've heard stories of many people who just jump shipped, who just jumped ship on faith, right? They just kind of got out there, did the thing, and it worked out for them. Wonderful, great. Not saying that that can't happen, it definitely can. But I always recommend to have a plan. Just have a plan. It's crucial. It doesn't mean that you have to stick to the plan. It's equally important to make sure that you are able to be flexible with the plan because things change. So you may have to pivot, but definitely set some clear goals about how you're going to move forward, right? And then allow yourself some grace, that there may be some adjustments that you may have to make. The second is to remember your why. So revisit your reasons for making this transition, right? So remember the goals and the purpose that you set for yourself 20 years ago. Again, 20 years ago might not align with where you are right now. So what is your why? And keep that front and center to guide you through the tough moments. Why are you deciding to make this transition now? What's important to you now? That has you thinking about making this transition. The third tip is always, always, always seek support, seek mentorship, the importance of having a mentor, having people who support you during this transition, having a coach. I always recommend that. I had to be coached through my transition, and it made a huge difference. Finding someone who can help you to navigate and provide you with that accountability, helping you to see and overcome your blind spots, and just having someone who has walked that similar path and can offer guidance. And then the fourth tip is just give yourself permission to evolve. I think that's so important. Allow yourself to change and know that that's okay. It's okay to change. You're supposed to grow, right? You're supposed to be redefining yourself as you kind of age and move gracefully through your career. So, your career transition really is not just about the new job, it's about the person that you're becoming as you are seeking out this new career transition. So, give yourself permission to evolve into this newer, better, and more improved version of yourself. So, when we're thinking about career transitions, especially in this demanding field of healthcare, again, it's not easy. But I'm here to tell you that it is possible, it's doable. A lot of times, these crossroads that we embark upon are necessary for us to grow, it's necessary for us to feel fulfilled. It's necessary for us to move into that next thing where we are going to make a bigger impact. And remember that you're not alone on this journey. There are many women in leadership who have gone before you, who have done this. You can listen to some previous episodes in the podcast about, women who have gone through these transitions in their career. But with the right support, with the right team and strategy, you can do it as well. So, thank you again for joining me today for this podcast episode. And if you are standing at a crossroads and you need guidance, I'm here to support you. So feel free to reach out to me for a discovery call, and I will have the link to that discovery call in the show notes. So let me also share something with you today as well. So as I'm thinking about, this podcast episode of Crossroads, I also was at a crossroad with the podcast because in my journey of being an executive leadership coach, not only have I helped physicians, but I have helped other women in healthcare leadership. And in order for me to continue to reach the people who I feel like I can help, in order for me to be able to spread my wings, to spread my voice, to share the message to more people, I'm going to be changing the direction of the podcast and not really the direction. I'm still talking about leadership, I'm still talking about career tips as well, but I'm expanding the audience to include women in healthcare. So that could be, you could be a physician, you could be in clinical medicine, you could be non-clinical, but in healthcare, right? Leadership. I want to really open it up and expand the reach for this podcast because I feel like we can all benefit from that. We could all help each other. We could all serve as mentors, to each other or as support to each other. So look out for the new podcast title, which is Leading Ladies in Healthcare: Leadership and Career Tips for Women in Healthcare Leadership. So, if you are already a subscriber to the Women Physicians Lead podcast, you don't need to do anything, just continue to listen to us. But our new podcast drop date will be on Tuesdays instead of Fridays. So we will have a new podcast cover, we'll have a new drop date of Tuesdays instead of Fridays, and we will still continue to cover relevant content to help you along your leadership and career journey. So until next time, take care and remember you're not just making a career change, you're stepping into the next chapter of your life. Take care and have a great, great rest of your day. Until next time.